Hi, this is Tom Salemi from OIS TV. I'm very thankful to have Ashley McEvoy, Company Group Chairman of Johnson & Johnson Vision Care and Diabetes with us.
It's a pleasure to be here, Tom.
We did a podcast a few weeks ago, and you broke the charts. You were our top listened to podcast. So congratulations!
Well, we gotta go beat that. Thank you, Tom.
Yes. So let's see what we can do with this video. All right. And all we did in that podcast was talk about this really cool deal, the acquisition of AMO, which really is kind of shifting ophthalmology, the players in ophthalmology, and it was a theme today that Emmett led a discussion about building ophthalmic franchises between Zeiss and J&J and Sun. There's just so many new players coming into ophthalmology. It's great for me because there's a lot of stuff to talk to and more people to talk on my podcast. But what do you count that to? That so many big players are kind of starting to elbow each other for a piece of the ophthalmology pie.
Well, I think you heard me say that on the panel. I do have huge respect for a lot of the pioneers in the industry because they're the ones who had the vision and the courage and, quite frankly, the tenacity to stick with it. So J&J, I like to say, is old and new again. We were early on in the implant business and cataract surgery.
Mm-hmm.
And then we went to go build a little contact lens company.
Heard about that.
That's
How's
now
that doing?
turning 30. AccuView, it's back growing faster than the market, so I'm pleased to hear that. Just getting going, some really neat, meaningful innovation. So, we actually think, I think ophthalmology is really special. There's this unique intersection of the clinical aspects and deep science, but a lot of the practitioners are also entrepreneurs.
Mm-hmm.
And so there's an appropriate thirst for innovation. And then a unique collaboration that everybody really wants to get to the improved patient care.
What does the acquisition of AMO, when it closes, what does that signal to the market? Is this the first step of many for J&J? Is this this is what we have, this is our team, we're going to run with this team? What do you think? How does this play out?
So, I would say a couple things, Tom. I'd say number one, eye health is very attractive to us. We think it's one of the top 5 healthcare segments in the world. It's growing north of 5%. Significant unmet need still exists. Us as contact lens, when we are interested in Abbott, have huge respect. Number 2 surgical company around the world. Very strong in cataract, which is the number 1 medical procedure done. Still number 1 cause of preventable blindness. We expect that to continue to grow, and particularly to open up in emerging markets. They have a very strong refractive business. We have some hopes around really cracking that model going forward and maybe leveraging some of the power of the brand. But I would say that it's really important that we get a sound foundation in surgical ophthalmology. And then, as we've heard today, there's a lot of disruptive innovations on the way, and we have to make sure that we pick the right bets and add to the bag. But we have to stay focused on closing and doing a sound integration and extracting the right value for our customers and patients, and then adding on.
How was this viewed when the deal was being talked about? Is this, it's all within vision care, but contact lenses are different than surgery. Is this an adjacent market, the acquisition of AMO? Is it sort of bringing an entirely different, new kind of business in eye care? How is it viewed inside J&J?
We consider them quite complementary. When you look at a lot of the shifts that are happening in the marketplace related to the 3 O's, we actually see more convergence over time. And, we always like it when professions are skilling up. And so, I'll use cataract surgery as an example. So optometrists are doing a lot of pre and post-op in cataract surgery, and that's a good thing. It lets the surgeons be in surgery. And so we really think that there's an opportunity to have a better collaboration of care. And that's where the 2 worlds kind of come together. And we think J&J is somewhat uniquely poised to aggregate some of that and create some of those bridges so that we really have a beautiful collaboration in patient care.
What does this organization look like when the deal is done? Is it going to be, and I think traditionally J&J, when make an acquisition, they allow it to stand alone and operate somewhat independently. Is that how we'll see things develop, or because you have the eye care, this might be a different way to go?
No, AMO is very strong experts, obviously, in surgical ophthalmology, which Johnson & Johnson does not have. So it's very complementary. We'd like to have a surgical ophthalmology, platform. We're going to have a contact lens platform. We're going to leverage all of Johnson & Johnson and outside Johnson & Johnson to really bring, differentiated innovation to surgeons and to patients. And then, take advantage of collectively the geographic access that we have. as well as, we have 100 teaching institutes around the world in Johnson & Johnson to really give access to doctors and do the right training. In many parts of the world, as you know, that there's just not really good access. There's not a lot of certified healthcare professionals out there, so we like to continue to work on that, and then really leverage and unlock the power of the brand.
Mm-hmm. And what do you have yourself in the early stages that we should know about? And let's get into that, and then I'll have a follow-up question on innovation.
So you'll have to talk to AMO about their pipeline.
Sure.
So talk to Tom Frenzy.
I will do that, I promise.
We are looking at, presbyopia is really important to us in the area of refraction. Myopia control is really important to us. We're looking at dry eye. We're looking at active contact lenses. Mm-hmm. We're looking at custom contact lenses, custom vision. A lot of these areas have application in the implant space as well. So we actually think there's a neat convergence there for whether it be exterior or interior.
And do you see yourself with this sort of bigger vision care organization tapping into the JJDCs, the labs, and your whole early stage infrastructure? Does ophthalmology become more important to them as a result, or is there not really a connection between the two?
No, I mean, they're an extension of Johnson & Johnson. They are us. So, we spoke about today is really anchoring yourself where innovation is. So whether that be San Francisco or Boston or Israel or Shanghai, we have innovation centers all around the world. And we have put several, investments in some of the early ones. We've got one in Revision Optics, one in Power Vision. Mm-hmm. So we've been keeping a close eye. Obviously, post close, I think we might dial up our ambition in this area. And I'm really encouraged with some of the evolving science and technology that's starting to really come to fruition.
Excellent. Well, it's going to be exciting to watch. And
thank you, Tom.
We're hoping to top the charts with this video. So share this with your friends.
We're the new kid on the block. We're really here to learn and help patients. Thank you.
Thank you for the time.